Welcome to Kids Considered, where two pediatricians discuss children's health topics of interest to parents in a podcast with new subjects considered every episode. I'm Dr. Lena Vanderlist.
And I'm Dr. Dean Blumberg.
And we're both pediatricians at UC Davis Children's Hospital in Sacramento, California. So I am so excited to talk about our topic today and chat with our guest. So nearly every day in my office as a general pediatrician, I have parents that come in with concerns about their children's speech. So it might be speech development, right? Their 15-month-old hasn't started saying any words. Or you might get to the toddler stage, like Mira is 2 years old now, and she has all of these hilarious speech articulation issues. So whenever she is talking about like my book, she says like Mish book. Mish birthday. Or when my husband and I need a good laugh at night, we like point out a picture of a fox. And I think you can imagine what she says when she sees that. It's not appropriate for the air. As kids get older, they can have a whole host of other things. And one of the more common things that we see is speech dysfluency, which is also known as stuttering. And that is what we're going to talk about today.
Right. So many parents become concerned about speech dysfluency or stuttering. And it's important to understand that stuttering can be a normal and natural part of a child's speech development.
Right. But we want parents to understand what is normal and what might need additional help.
So to help us explore speech dysfluency or stuttering, we are pleased to welcome Dr. Aishah Patterson. She is Associate Professor in Communication Sciences and Disorders at California State University here in Sacramento. And she is also a licensed and certified speech-language pathologist. She has research experience on the physiologic stress response in school-age children who stutter. So really, we're so pleased to have you here this morning.
Absolutely, Dr. Patterson. Welcome. You're the perfect person to educate us about this. Us as medical doctors get almost no training in speech disorders or dysfluency. So I am so excited to learn from you today.
Excellent. Happy to be here.
Great. So let's start by defining stuttering. What is the definition of stuttering?
Stuttering is described as difficulty with this forward flow of speech. So when little kids start to have disfluencies or stutters, we see typically they are repeating sounds, and we call those repetitions, where all of a sudden they have a sound, usually at the beginning of the word, that they start to repeat. Sometimes we see other stutters, like where there's a stretching out of a sound, and we call those prolongations. And then we do see some other types where all of a sudden the child may get stuck in a sound and their mouth may be sort of frozen in a position, and we call that a block, where all of a sudden they may have a short period of time where there's no sound or air coming out.
So how common is stuttering in kids?
Stuttering isn't super common, but we do see it typically for kids between 2, 2.5, maybe up to 4. Typically around this time during like a language explosion where kids are saying lots of words and learning lots of new words and putting words together and starting to have longer phrases. But for kids, we usually see about 5% of kids have a stutter. But as they grow up and get older, we see a lot of kids will spontaneously recover, even without treatment. So the worldwide population, we usually see the prevalence rate at about 1%. So a little bit higher for young kids, around 5%, but a lot of those children spontaneously recover. They just stop stuttering on their own.
So this might start at the beginning of speech development, or sometimes kids will have normal speech development up to a point, and then they'll start developing stuttering?
Yes, exactly. So we usually don't see kids start to have these repetitions or repeating sounds right when they learn their first word, right? It's usually after a period of time where they have more and more words and they have more and more to say. So it's typically around this period of language explosion where they have lots of things they want to tell you and they're super excited, and they just may get into a repetition like that.
So we know, like, just like you said, maybe around 2, 3, like, language is exploding. They're starting to repeat everything they hear. I definitely am seeing it in my own life with my own child. So why is it that this critical period is the time that parents might start to see that?
Kids have lots of things to say, right? And their cognition is increasing, their language skills are increasing, and it's just this period of adjustment. Lots of kids will have some disfluencies during that time.
So many times it will be temporary and go away on its own as your child, increases their vocabulary, kind of learns to slow down and process what they're thinking before saying it. But sometimes it doesn't go away on its own. And so I guess what age would you be a little bit more concerned for stuttering continued? And how often does a child, not grow out of the stutter?
That's a really good question. And this is probably where we provide lots of support for parents because they have these very same questions. When should I be concerned, or when should I seek help or support for my child? What age? So just trying to provide some, at least some additional information, some guidelines that we typically follow. So lots of kids have disruptions or disfluencies or stutters in their speech as they're starting to use language and have more and more words. So that's typically 2.5, 3. Lots of kids have disfluencies. But when we see kids have their languages explosion around that time, 18 months to 24 years of age, and their disfluencies aren't going away, or if they're becoming more pronounced, usually we have this cutoff around about 5 years old. If we're talking about a child with normal, typical language development, and they've had some disfluencies during that period where we typically see them. But if they're continuing beyond 5 with those disfluencies, and now the disfluencies have been happening for, a year or 2 years, and they've noticed that they've become a bit more pronounced. Maybe the repetitions have become longer, or the stuttering has become more involved, where it's moved away from just easy repetitions to more instances of getting stuck or stretching out the sound. So most kids, around 75%, will spontaneously recover on their own. And we see about 25% of those kids that started to stutter may be moving more towards persistent stuttering, especially after age 5, age 6. We see some reports that'll go up to about 8 years old, depending on their language explosion was, right? Because we have sometimes kids may have language develop a little bit later, then we sort of move that timeline. But typically 5, 6, 7, if those disfluencies have not resolved, then we're providing parents with a bit more support.
So somewhere around kindergarten, first grade, and so teachers are going to pick up on this too and may bring it to the parents' attention.
Exactly.
During that language development period, so let's say the kid is 4 and a parent is noticing one of these disfluencies at home, I always think about, sometimes for kids, like in my personal experience or friends, you would almost want to finish the sentence for them or like help them get the word out, right? When a child is struggling, you're like,
Mhm.
okay, come on, just say the word, or like, this is what you mean. And what like tips do you give to parents on how to work with a child that has a stutter? I'm guessing that's the wrong thing to do.
It's typically what we do, what we want to do intuitively when we're trying to help, right? If we see a child get stuck or are repeating sounds, we try to assist with, oh, you want this and speak for them or finish the word. And we try not to do this. Oftentimes we don't get it right. We need to just wait for the child to get out what they want to say. And I think, we're so used to just a fast paced life, and everything moves quickly. Really, the support that we suggest is to provide a bit more wait time. Give the child a chance to get the word out. We try to reduce distractions so the child has the sense that I have enough time for you. It's okay. I can wait. And so we kind of tune in, make good eye contact, try to reduce the distractions, and just allow them the time. So we don't want to interrupt. We try not to interrupt, right? And we try not to fill in the word for them.
I guess I'm just reminded of the movie A Fish Called Wanda. And one of the characters is stuttering, and everybody's really patient until the tension kind of ramps up. And then they start pressuring this character and like trying to finish the sentence and just get it out. And then they like back off and they say, no, we got time. We're patient. Just take your time. And they just don't know what to do because they just go wildly back and forth.
Yeah. Oh, it's an older movie. It's a great one. But yeah, that's a really good example. We feel like we're helping if we help them, let me just help you get the word out. So we have this sense then that the person doesn't know what they want to say. And even the child, it's not any sort of challenge with cognition or language. It's a motor speech challenge, right? So if we're talking about persistent stuttering, especially, we just want to give them a bit more wait time and they'll eventually get to the word.
Well, I love what you just said. I think it's really important to like reinforce for parents is that it's not a cognitive issue. It's not that your child is slower to process things.
Right.
It's not that they have a learning issue. It's that they have an oral motor issue or a sort of issue getting out what they want to say.
Right. Exactly.
At what point should parents consider seeing like a speech language pathologist for their child for stuttering? Is that always indicated? Is there a certain age, or does it depend on the difficulty that the child is having? What sort of criteria is used for that?
I would say my first initial response is parents should feel free to reach out to a speech language pathologist at any point when they have questions or concerns. In terms of, what age would we be providing more support? As a child gets older, we're starting to see a lot of other things associated with stuttering. As the stuttering persists and they have more and more difficulty, if the stuttering is becoming more pronounced or more severe, and then if they're starting to experience, let's say, listener reactions. So around 5, kids cognitively, they start to recognize, oh, like my speech might sound a little bit different from someone else. So if we start to, especially if we start to have kids have those associated feelings or emotions around stuttering where they're, not wanting to talk or saying something like, Mom, I can't get it out, or showing any signs of frustration, absolutely, please seek some additional support and assistance. The goal is to not have the child, because of stuttering, not want to talk or not want to engage.
I would love to hear some of your research because you talk about, it sounded like Dr. Dean mentioned you do some research within sort of like the social implications of stuttering. What have you found in your research in this topic?
So my previous research has looked at the stress response for stuttering. So I've been interested in looking at, okay, we know that stress doesn't cause stuttering, right? Stuttering has a strong genetic component, but stress seems to be related when you talk to little kids who stutter, especially once you get to like school age where they can accurately start reporting how they feel. They'll report that, well, when I get nervous or when I meet new people or it's someone I don't know, this increase in stress has an impact or influence on the severity of the stutters. So I was interested in looking at, okay, we have a lot of information around the stress component as it relates to adults who stutter, but I hardly had any information around young kids who stutter and what their stress response is. And we've typically been left with parents' report of their child's stress because they're so young, right? And not that the parent report has no value, it absolutely does. But I was interested in looking at, okay, but what's going on physiologically with the body? Do we have this spike in stress hormones for young kids? And my research is still ongoing. I, worked with a small sample size, but with the children I worked with, their cortisol or stress hormone levels weren't off the chart and what we were expecting, but it did not turn out that way.
Interesting. Well, that's actually probably a good thing, right? Because we know, and we've done previous podcasts. We just had Dr. Nadine Burke-Harris, who talks about childhood toxic stress. So that's like when that cortisol
Mm,
level is too high for too long, all of the negative effects it can cause. And so, in the end, from a medical standpoint, that's actually a really good thing that they're not having those, high cortisol levels persistently
mhm.
with speech. So, I mean, even though it was a negative outcome, it's a good negative
Right.
outcome.
Definitely an area to continue
Yeah,
continue researching with a larger sample size.
for
Absolutely.
sure. Yeah. So, I wonder if we can go into some more of the misconceptions around stuttering. So, I think that you mentioned one already, which is that it is not associated with any cognitive, issues or intellectual disabilities. Other things that sometimes come up, like you also talked about, it's not caused by anxiety or nervousness, but it can sometimes be exacerbated by
Exactly.
anxiety or nervousness. How is there any other common misconceptions? I know sometimes parents ask me about relationship with tongue ties or other, oral things like that.
Yeah.
To your knowledge, is that related at all?
No, I mean we've heard a lot of stories around really old remedies for stuttering. So we really don't recommend anything like, clipping the frenulum or, some really old studies with, there should be pebbles in the mouth and then, that will help the child stutter or stutter less. And so, I mean, we're really looking at some challenges. Let's say this is a persistent stutter, right? Like if the child continues to stutter, we're looking at strong genetic component for stuttering as opposed to, you know, um, something that the parent has done that's not accurate. There's no, as you said, cognitive or language difficulty that's resulting in the stutter.
So when stuttering happens, the parents shouldn't say, "Oh, it's something I did or didn't do, or I should have read to my child more or talked to them more," or something like that. It's not their fault.
Exactly. We do hear this often, especially with young kids. The parents feel like, well, the child has, been with me all day and I'm the one, at home with them. Is this something I've done or haven't done? Being critical of the speech, did that cause the stuttering? Me pointing it out, did that cause the stuttering? No, absolutely not.
So once a child makes it to your office for stuttering, and then is stammering and stuttering the same thing?
It's the same thing. Yeah, usually in the United States, we usually hear the term stuttering.
Okay. Yeah. So once they make it to your office, what would a typical session look like with you working with a kid with a stutter?
We want to make sure we thoroughly assess what the concerns are. But let's say we have a case where the child's stuttering didn't go away. They're past 5, 6, 7. The stutters are becoming more pronounced. And the family said, you know what? We have some concerns. We don't want to see our child struggle. Or maybe there are some other concerns at school where kids are pointing the stutter out. once you start getting to older children and persistent stuttering, then there could be things like bullying, things like that going on. So now we're in the area of, okay, we need to provide some support. And this would be now what would be called direct therapy. So we may be working on techniques to try to stutter more easily. We may be working on controlling their rate of speech and easing into sounds. We may be addressing their overall thoughts and feelings around stuttering. So we can't cure stuttering. That's not going to be the goal of treatment if the child is now past that period of spontaneous recovery and they're persistent. We're now supporting the child and the family with living with stuttering, but stuttering in a more easy way, and hopefully not developing a lot of escape and avoidance behaviors. So these are learned behaviors where children will start to develop tricks to get out of the stutter. So we talked about early stuttering where there are easy repetitions, but as the stuttering has been going on for longer, these repetitions may become more pronounced, and we start to see muscle tension and a bit more stress associated with the stutter. So now we're trying to sort of move back from that and have easier stuttering, not being afraid of stuttering. And oftentimes, just practicing those kinds of techniques, we see the disfluencies go down, right? It's when the child is, I'm getting stuck, they start to learn other tricks. So we see escape behaviors like starting to have a facial grimace during the moment of the stutter, or starting to move the eyes or move a limb to help them get out of the stutter. So moving other parts of the body. So this is an indication like, oh, this is getting a bit more severe, and they're developing these learned behaviors to get out of the stutter. So those may be some of the things that we address. Similarly, avoidance, they may start to avoid talking. Those would be some things we'd want to address in treatment.
Is there any role for, I think there's a specific type of speech therapy that is like an orofacial myofunctional therapy? I know that you said there's an age at which the stutter is probably going to stay with you for your life. And what age around is that?
There's a range. Historically, we've said around 5, right? But as kids are having their language explosion later, we've sort of been moving this timeline a bit. So anywhere between 5 and 8, they could still be in that period of just spontaneously outgrowing it, right? But once we get past 5, 6, 7, 8, 9, and they've been stuttering since early childhood, let's say they've been stuttering since 2 or 2.5, we are expecting this to be persistent stuttering. That doesn't necessarily mean severe stuttering. It's just that we won't be able to engage in any treatment practice that will eliminate stuttering to 0. That won't be a treatment goal.
Right, but that doesn't mean that we wouldn't do treatment because we could still make it easier.
Exactly.
Gotcha. How about that type of therapy that I mentioned before? Any benefit to that for any age kid?
I have not personally used that or have seen anyone use that.
I always think, at this point about probably one of the most famous people in the United States of America right now that has a stutter. Do you guys know who that is?
Is it the president?
Yeah.
Mm-hmm.
Joe Biden.
Mm-hmm.
President Biden. I remember during his, election campaign watching this like super moving, powerful ad, I guess, about him dealing with his stutter as a child. And I mean, gosh, talk about a success story. You can still hear it sometimes when he is speaking, but great speaker, really good at getting his point across. And so I feel like he is just, an inspiration to a lot of kids who are dealing with this.
Yeah, absolutely. He does have a slower rate that probably helps quite a bit. But yeah, just because the child has a persistent stutter doesn't necessarily mean that it stays severe or that it's severe all of the time. You do see fluctuations where there may be more stressful periods and the stutter sort of, flares up for a bit. But then if they're engaging in a slower rate and not hiding or running from stuttering, then we typically see the dysfluencies go down.
Yeah, so parents should know just because your child stutter doesn't mean that they can't grow up and be president or whatever.
That's a great takeaway from this episode. Well, Dr. Patterson, thank you so much for spending the time with us exploring stuttering. Dr. Dean, should we summarize today's topic?
Yeah, let's do that. So we talked about how stuttering is quite common in childhood, usually appearing sometime between 2 and 4.5 years of age. About 5% of kids stutter.
Yeah, and while in the early developmental period, this is totally normal during that language explosion, if you're noticing stuttering persist, between the ages of 4, 6, you definitely want to reach out to your pediatrician. If a teacher brings up this concern, it's a great idea to get your child assessed by a speech and language pathologist.
Right. Remember, this is not an indication that they have cognitive or learning problems. And what parents can really do to help their child is to really be patient with them.
There are lots of skills that they can develop over time to help slow the rate of speech, kind of decrease the anxiety associated with public speaking. And many kids do extremely well with stuttering and can even become the president of the United States.
Right. So we would like to thank Dr. Aishah Patterson, Associate Professor in Communication Sciences and Disorders at California State University in Sacramento, for joining us for this episode, although Dr. Lena and I take full responsibility for any errors or misinformation. And also, I would like to thank one of the nurses that we work with, Jennifer Sutherland, who suggested this subject, that we should address this on our podcast.
Thank you, Jennifer.
And before we go, can I just talk about, did you guys hear about the panda that had a little stutter?
No.
It's a story that bears repeating.
Oh my goodness.
Dr. Dean ends every episode with a joke.
A bad one.
That was prepared for that one.
That was better than most of his. So
we love it.
That wraps up this episode of Kids Considered.
You can find more information on our website, kidsconsidered.ucdavis.edu.
Follow us on Twitter at Kids Considered.
And Instagram at Kids Considered.
If you have feedback on this show or topics you would like us to discuss in the future, we would love to hear from you.
Please call us. Our number is 916-915-3388.
Or email us at kidsconsidered@gmail.com.
Please rate us on iTunes or wherever you subscribe to your podcasts.
Thank you for listening, and we hope you will join us for our next podcast.
Kids Considered is sponsored by UC Davis Children's Hospital.